So if you have pain in your epigastric region here and you have ulcer, there are videos where I explained what ulcer is, but I like to do it all the time because of the times we're in. There's a lot of content going around. People don't have strength to go and search for something that will help them, So I tend to repeat myself each time. This might be the first video you're finding me with. So I'll just quickly run through how ulcer happens and the cousin of ulcer, the other one that looks like ulcer. And a lot of people have biology backgrounds, but it's not difficult to understand that when you swallow, what you're swallowing goes through your mouth, hits your esophagus. It's a tube, a muscular tube that descends up to the stomach. And the stomach is where the whole food is churned, And then when the processing is done in that space, the food is now sent through the intestines. It's a small intestine, a couple of coils to it, and the large intestine out. Now, in the stomach, there is acid in the stomach that does food digestion or participates in food digestion. But what it also does there is bacteria can be in the stomach. It's acid. When we take the acid in the stomach, when we go inside your mouth with a spoon and we take the acid in the stomach, liquid, I'll pour it on your skin, it will wound you, it will injure you. So it's acid that is there. But you're wondering how come the acid does not burn normally if it's that much of acid? And the reason is because inside the stomach, the wall, God put something that can stand the acid to where it doesn't feel hot to you while it's there. It sits in that space to make sure that whole area is sterile, doesn't have bacteria activity so much, and also sits there to digest and break down food. But what happens now is this: the bacteria, the commonest cause of ulcer, H. pylori, the bacteria that causes ulcer, it gets into your mouth gets into the stomach from your mouth. So people who have the bacteria, who have ulcer, and the ulcer causing bacteria, every time they go to the toilet, they defecate, the bacteria comes out through the anus. And like I was saying the other time, I use toilet paper when I go to the toilet. Some people wash. Some wash with water, And I ask them, do you use soap at least to wash? When you're done washing, what happens to your hand? There's a chance that when you finish washing your hand with water, the hand feels clean, and then you don't wash it or forget to wash it. And if you pass some of the bacteria, if you touch any surface or do anything, you are transmitting what the bacteria on that surface. And if it's food that you're preparing, then somebody else has now ingested the bacteria. But when the bacteria goes in and gets to the stomach is too hot. It can't stay there. It's very hot. So it now veers off. I don't have a crack on this wall. But if you picture a crack on the wall, so this wall was built for acid. Acid can sit here and doesn't feel. That's how the stomach wall is, and it's made for the acid. So everybody sits there and there's no problems. But when the bacteria comes and it's so hot here, it creates a crack in the wall to hide away from the acid. That crack is like an injury. It is the injury that the bacteria created while running away from the acid that the acid now starts burning. So the original surface that was there before, no problems. But when the bacteria now breaches it, the injury it has created, the acid starts burning. And then most of the time, it comes here, right here. And the pain, until you do something about it, is so discomforting, so uncomfortable. Sometimes it gets to the back on the same side, But there's another condition called gastroesophageal reflux disease. And that condition, again, when you picture the esophagus and the stomach, they're supposed to be, when food goes through the esophagus, at the junction between the esophagus and the stomach, there is they could call it a sphincter. It's like a closer, something that closes. So when you swallow, it's closed. When food gets there, it opens up, food goes into the stomach and it snaps closed like that. So what it allows, the whole of the alimentary canal, the whole gastrointestinal tract, it beats like this. It's called peristalsis. So the beating action of the stomach, what it tends to do is to push food all the way down till you defecate. But then if you picture what I'm saying, when we get to the stomach and the churning is happening like this, because you agree with me that some of the food will be going down with the churning action, but some of it may be bouncing up as well. Now, if for any reason the closer at the junction between the esophagus and the stomach is loose, the churning action in the stomach will send some of the food back up, send it back up. So you have food doing this in the esophagus. But then the food we're talking about that is in the stomach is now mixed with acid. And remember, the acid was built for just this wall in the stomach. The wall inside the esophagus is a different material from the wall in the stomach. So some of you say, I have reflux, I have reflux, and you're playing with it. What happens is when the food takes the acid and it comes through in that way, it keeps irritating the wall of the esophagus and causing something that feels like ulcer pain as well, because this place is not built for the acid. It will pain you when it touches this part, but it doesn't feel that anyhow when it's inside the stomach because the wall was made for the acid. So when that irritation keeps happening, I used to teach people when I explain these things to patients. I usually take a biro and I hit them on the sharp end of the biro and I hit on the hand. I tell you, if I keep doing this to your hand, after a while, that part of the skin where I'm using a sharp biro on will become harder than the other side of the skin. And it's becoming harder because the skin is trying to protect itself from injury. So there are parts of our legs that have harder skin than the other parts. You know, there are parts. If you go look at your leg, because you're always wearing a shoe, you know, and that shoe, it has some pressure it's putting on that part of the leg. You know, so for the skin to not ulcerate and get an injury, it becomes relatively harder than other sides because of that pressure that's on it. That's why some parts, some of us, somewhere under the toe, somewhere by the leg, if you feel they harder than normal skin, it's your skin becoming tougher to resist the external pressure that is feeling or the external influence of injury, possible injury causing external factor. So it's trying to make sure that you don't get an injury. So the same thing happens in the esophagus. When food has acid and acid itself refluxes, that is goes back up through the esophagus and is doing this through that closer we talked about, and is doing this and is doing this. After a while, the body attempts to adjust the inside of this esophageal wall, attempts to adjust it to protect it from the acid. So the wall of the stomach and the wall of the esophagus is called epithelium. The epithelium of the stomach is a certain type built for acid. The epithelium of the esophagus, including that lower part, is also a certain type different from the one of the stomach. But what happens is, you now find out that this part of the esophagus starts changing into the epithelial type that's in the stomach because that's the type that can withstand acid. This action of changing from one epithelial type to another is called metaplasia. Now, the simplest definition of cancer is change in cell type. That's the simplest definition of cancer. So when cells of the epithelium of the esophagus start changing to adjust to irritants and injury, and we know that cancer is changing cell type, what the condition that appears in this lower part of the esophagus is called Barrett's esophagus. It is a pre-cancer state. So what it means is it is not cancer, but it is going towards cancer. So if we catch it at that point and we stop the irritation and do certain things, you can call me if you have that condition, so we'll sort it out. But we stop it, we can walk the epithelium here back to normal because it's pre-cancerous. But if this continues and it works from pre-cancerous to cancer, there's nothing you can do again about it. That's when you start hearing things like, we have to cut off, depending on how far. Because most times cancer starts, you don't even know it's there. You know, it's not, cancer is not, it doesn't cause pain. That's the same thing with hypertension. Some of those conditions that give you almost no symptom. By the time you find out there's a problem, it has gone far. You know, so the person who found it early itself, the person who is, I don't know how, maybe you do endoscopies pretty often, and you find that there's cancerous epithelial cells. The same person will have to go through surgeries to where we'll cut off some meters away from where the thing is. You know, because we found it early to assure that the cancer cells have not gone away from that place. So we'll cut somewhere here and cut somewhere here. Picture what I'm saying in your head, you see. And then we'll now bring these parts and this part back together after we remove the diseased part. Are you seeing? For the guy that came early, the one that came late. So something as simple as I get ulcer, and ulcer is very treatable. It's very treatable. The same injury that is there that acid is burning. Every time you're taking antacid, you take it to cool down, take it to cool down, and there's an injury. The body is not supposed to be injured. Look at your skin. There's no injury on your skin. There's not supposed to be an injury on the skin. So there's injury. If something happens, you hit your hand and there's an injury. You see what happens there. The time the injury happens, it looks very neat. But after 24 hours, the whole place looks busy because the body shows up there with a couple of cells designed to fix that injury immediately. So if somebody keeps hitting that part that's injured all the time, after a while, there's something we call marginal ulcer. It's a cancer on top of a wound. So because you're always hitting that injured part, the body is not comfortable with consistently injuring it. So it starts changing the cell type. It starts changing the cell type to attempt to protect itself from what you're doing. And it is the change in the cell type that will now change to become, to be forewarned. To be forewarned. Let us know. Call us.